This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
Welcome to Us versus Them, Patients and Caregivers Confront Healthcare. I'm Marianne Sterling. Thank you for joining us. This episode is focused on a topic that does not get enough attention: chronic pain. A 2022 study published in the journal Pain found that 50.2 million adults in the U.S., that's over 20% of us, reported pain on most days or every day. That makes it one of the most common chronic health conditions in America. So if you suffer from chronic pain or know someone who does, this episode is for you. So buckle in, let's rip the Band-Aid off. I'm joined by one of my favorite advocates for this important discussion. She's Barby Ingle from the International Pain Foundation. Welcome, Barby.
Hi, I'm so glad to be here, Marianne. Congratulations on your podcast, and I look forward to watching it grow and thrive, and thank you for talking about these important issues.
Oh, it's so good to have you here. And I want to begin today with your personal journey. Can you share with us a snapshot of how chronic pain found you?
Well, it's been over 20 years, so it's a pretty large poster billboard now. of a story, but the gist of it, I first developed endometriosis, and I went through treatments for that, and I felt I had conquered the world. By conquering the world, I had a full hysterectomy and an oophorectomy, and was no longer able to even think about having my own child, and so I'm kind of brushing over that a lot. But I felt I conquered the world going through that surgical procedure after all the treatments they tried before that, and was doing okay for a few years, and I got in an 8-second car accident that changed my life, and I developed an autoimmune, a rare disease. It's autoimmune that also involves my nerves, called reflex sympathetic dystrophy. Reflex is anything automatic in your body. Sympathetic is your nervous system. It feels like I'm burning on fire, and dystrophy is loss of muscle and bone. Spent about 7 years wheelchair and bedbound, and I fought and struggled and went through the healthcare system to finally took 3 years to get a diagnosis and another 4 years to get a treatment that helped. And I am still, even this day, 20 years later, fighting for proper treatment and access to that treatment. So it's been a long journey, and I've learned a lot, and I suggest that people grab a pen, because we're going to be talking about some things that you can do, or ideas that you can do as listeners if it's affecting you or somebody you love.
You know, what does a person living with chronic pain experience today when they seek medical care? This is really of concern to me. What have you noticed?
Well, you get downgraded a lot, especially as a woman. You get downgraded a lot. You get doctors saying, is it really that bad? Or how can you go walk to the mailbox if you're in that much pain? Or how can you smile if you're in that much pain? And I trained my whole life to smile. So even when your team is losing 50-0, which some days your body is telling you you're losing 50-0, I've learned to push through and put a smile on my face. Walking to the mailbox, well, I am already dystonia. I have dystonia. My body locks up. If I walk to the mailbox, at least I'm moving a little bit, and to me that's a win. So if I decide to push myself through that, it's something that I chose to do and get through, and I might have to rest for a couple of hours after that. So when a provider doesn't believe what you're saying is true or what you're actually feeling, if they say, what's your pain level, and you give them a number, when they don't believe it, it's a lot harder to get the access to the treatment that you need, or that could help you lower those pain numbers. And we're not looking for, I mean, I love a zero pain and have a cure, but I know with our technology in the medical world now, we're looking to lower our pain levels and not necessarily have the ability to get fully out of pain with a lot of chronic and rare diseases. So really, that's the biggest thing is being listened to, understood, believed, and second would be getting access to the treatments that actually can help you live a better life.
Yeah, there's a lot of gender bias that occurs with chronic pain when you step into a doctor's office or a hospital, and as you said, they don't believe you. And I want to refer our listeners to episode 1 of my podcast that talks about gender bias in healthcare, because I think that's an important part of this discussion as well. And I got to say, I also have personal experience with chronic pain. I lived with a condition called frozen shoulder for 2.5 years. I was unable to use my dominant arm for most of that time. The pain was literally what is referred to as suicide level pain. And yet, trying to get a proper diagnosis and then treatment, which for frozen shoulder really does not exist, was not only challenging, it was very destructive. When people don't believe that you're in pain, you're trying to articulate that and they don't believe you, it is very destructive. And I had personally struggled, as I said, with the invisible nature of chronic pain. It's something you can't see. So how do we get past the stigma associated with a condition that nobody can see?
One of the things that I do when I go and I present to medical professionals as well as out in the public. And I've brought clothes clips with me and said, if you do not have pain, don't do this if you have pain, but if you do not have pain, put this clip on your finger and try to listen to my presentation and see how long you can keep it on your finger and still concentrate on what I'm saying. And most of the people will be taking it off within 5 minutes and setting it down next to them. And there'll always be that one that kept it on the whole time, but they don't actually, they're still thinking the whole time, I'm going to keep this on. They're thinking about the thing on their finger and not the presentation that's happening. But it's a way to make the invisible visible, that, hey, if you have something going tap, 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 something's wrong, constantly, that's what it's like to live with an invisible chronic pain condition. And I've gone through frozen shoulder myself, and with that, you don't always have a direct injury. The injury that I got that caused the frozen shoulder was not to my shoulder. It was to my arm. And why did my shoulder lock up? I don't know. I wonder now, after hearing your story, if it has to do with hormones and the fact that I went through menopause at such a young age. And is there some kind of balance that they're missing that could have helped me, that I wouldn't have had the frozen shoulder situation for all the going through that on top of living with a chronic rare disease as well.
Yeah, and I also want to refer my listeners to episode 2, which is a throwdown on frozen shoulder. So I got together with some of my 50-something friends who all have frozen shoulder. And if you are a woman of a certain age, or a woman, if there's someone who's important to you, who's 50-something, you got to listen to episode 2 on frozen shoulder. So this is a great discussion. I'm glad we brought this up. So what does chronic pain cost those who have it? It's not just about your health. There's so much more here, Barbie.
Absolutely. Chronic pain affects every single aspect of your life. Physical, spiritual, financial, emotional, relationships, communication. Every aspect of your life is going to be affected. And when it first happened to me, I was I felt like a crab in a bucket trying to claw my way out, but everything I grabbed onto just fell back down on me. And the harder I fought to get out of this boiling pot, the worse it got. And when I stopped and took notice of, oh, my finances need to get back in order, my way of speaking, it was learning a whole new vocabulary and being able to talk to a medical professional. Nobody teaches us how to talk to a medical professional. And so I'm like, this is something that should be taught in elementary school. And not just to trust the doctor, but have them on your team with you, recreate that experience so that you go in and you have a plan and you get out of those medical appointments what you need out of it. Same thing talking to the loved ones in your family. I lost so many friends that just didn't understand, or they didn't know what to say, or they thought I was just seeking attention. Like, believe me, I'm Barby Ingle. I don't need to seek attention. It finds me. I don't, this is not the intention I want. I want to live the life that I had. And the people who really knew me understood that, but they didn't understand. And so I would lose friends for not knowing what to say to me. Besides, I'm sorry you're going through that. But you know what? Just having somebody say, I'm sorry you're going through that, can be enough. And it can be like, okay, at least they are acknowledging that something is happening that's made this major change in my life, and I needed to hear that, but they didn't know how to say that. And so just the empathy in that. But again, in society, we're not taught, how do you help somebody that has a chronic illness? How do you help somebody that wasn't born with something that was different or unique to them, that they had to learn how to overcome that challenge? This happened to me at 29 years old, in the prime of my life, and I'm a university coach that I worked my life to become a cheer and dance coach at a university, and that was just taken away. And not only was my job and livelihood taken away, but something that I knew since I was 4 years old, this is what I was supposed to be doing. And recreating all of that to bring it into a life that I can live now, that's purposeful, meaningful, getting the care I need, is still a struggle. And I've been living this for 20 years now. I developed RSD on September 26, 2002. So I'm in year 21 of this disease. And before that, I had endometriosis. So it's absolutely, I'm 50 years old. It's been more than half my life that I've lived in pain.
You know, speaking of challenges for the chronic pain community, we've all had to face for the past, 10, 20 years, an opioid crisis in our country. And this is not the same for the people who have chronic pain. This crisis became a much larger crisis for people who have chronic pain. Have you found that it's harder for patients to get the medications they need because we're being now so much more careful because of what happened with opioids?
Absolutely. The medical providers that trained and done the research and the studies and went to medical school is specifically for pain management and being that type of doctor or provider, they're afraid to prescribe. They're offering other choices that aren't necessarily thought out, or it wouldn't be their first line of defense. And for me, giving me a medication that might help or control the pain over a surgery, it's less invasive. It's something that can be used to help a patient live more life. And having doctors just taking that totally off the table, which many of the providers, especially here in America, I got to go speak in other countries and do presentations, and it's a little bit different there, but because you said they're being more vigilant about who they're prescribing and what they're prescribing. And now we're even having the FDA and the DEA are coming in and putting limits on how much medication can even be produced. So there's not only less providers prescribing it, but there's less being produced legally that's safe in a lab, that's monitored and well maintained, coming into our system. So, with so many millions of chronic pain patients that need opioid medication, it's about 20 million that need that chronic medication in their life. They're being forced into treatments and options that are secondary to the medication that was giving them life and allowing them to work, or that type of thing. So I think we have to look at the whole picture. Yes, we have to deal with abuse. We have to deal with the system and not hand it out like candy. But we also need to have the patients who need this to have access to it and have it be safe for us. Have it be monitored. Have it be controlled with labs that are knowing what ingredients are going in. Because a lot of the patients that got cut off or tapered down start going out to the streets to get medications that aren't monitored. And there's deaths from that. There's deaths from those people who said, I'm not going out to the street, but I would rather be dead than live in a level 8 or 9 or 10 pain. And I'm just not going to do that. And there's no hope for the future. And I have had friends that have committed suicide. I've had friends that attempted suicide and lived through it. And for them, they can't even get the medications that were giving them life, which is the whole reason why they tried to commit suicide. Now they live through the suicide attempt, and now they can't get the medications because they attempted suicide. It's one roadblock after another. And all of these that are flooding into my mind are women who are not getting the pain care. If a man walks into the doctor's office, they're believed when they say they have pain, and it's more typical that they will get a pain medication so they can go to get back to work, get back out there on the field, get to life. Women, they don't get that same respect or treatment when they go in and say, this is what I'm facing and dealing with. I'm trying to raise my 3 kids, or whatever their challenge or situation is outside of the chronic pain. They're not getting the help with the treatment options. I think, I strongly believe we should have individualized care. Each patient should get what they need decided on between them and their provider. And if the patient says, I don't want to have surgeries, what other options are there? There are great medications and options out there for patients. They're not right for everybody, but I believe that they should be on the table if the patient provider decide that's the path that they want to take to get that person back to living the life that they're here on earth to live.
And Barbie, you've alluded to some of this, but what is our healthcare system missing? What can our system do to better support people with chronic pain?
Individualized care. There's new genetics tests that come out. There's about 5 genetics tests that come out every single day that can test new things and give us a whole new light on a situation. I have gone through microbiome testing, and I've gone through pharmacogenomics testing, where the microbiome testing is testing my GI system, which is out of whack because of my rare disease. It gave me the foods that my body can process properly, and when I stick to that, I live better. With the pharmacogenomics, it literally, the way the FDA has now approved it and insurance companies are paying for it, you can go to your primary care doctor, or any doctor that can also prescribe this test. And they can give you a color-coded listing of all medications that are FDA approved and how you individually will metabolize them. If this is a red medication, they labeled it for us. For you, this medication is red, do not take it. This one is yellow, take with caution. Make sure your doctor is checking your blood levels, what have you. Or green, this one you will expect an absolutely normal result. And you know this before you get stuck in step therapy or fail first. They also call it fail first, where the doctor says, let's try this medication and see how you'll do. With pharmacogenomics testing, taking advantage of that and having your results that can go with you the rest of your life. And as new medications come into the FDA and are approved, that information automatically gets updated in your portal. So you don't have to wonder in the future, oh, this new medication, how's it going to work compared to this other migraine medication I'm on? You're going to know before you even have to try and go through all of those side effects. Right now, medicine and healthcare is working as designed very poorly, and especially females are not getting access to the things that are working best for them. As these options and testing and genetics and new things come down the pipeline, we need to make sure that not just our providers are learning them, but us as patients especially chronic patients, are learning them so that we can have those conversations and bring it up to our medical providers' attention. So, responsibility of the patient, responsibility of the providers. Sometimes it feels like a full-time job to get the care you need when you live with a chronic disease. It is your job. You have to put your own oxygen on first. You have to take care of yourself first, and then you can use what you have in resources and energy to help other people. Talk about your story, share it. Not enough people share. A lot of people go, oh, this is my medical history. For me, even, if I am diagnosed with something and I don't understand it, I have a hard time sharing it with other people so that they can understand it and without thinking I'm mentally incapacitated in some way. So I like to process it, know it, understand it, know what's my treatment plan, and then I can share it. And when we do share those stories, it helps bring a whole new level of understanding to society, which then can equip us with hope and help and resources that we never would have known existed. And a lot of them are coming online every single day. There's at least 5 new things coming every single day. What are they? Where are they? How do we find out about them? We talk about them, we share our stories, and we let other people know what we're going through.
Well, that's so true. Sharing our stories as people who live with a chronic condition, right? We don't hear enough of those stories. I truly believe, as you do, I know, that the healthcare system would make a few tweaks and adjustments if they heard our stories more often and more forcefully, right? We are speaking the truth when we speak as people with lived experience.
We are experts. Don't take your lived experience as, oh, this is just my crappy life or whatever you're thinking about your life. Take your lived experience and know that that makes you an expert of you.
Yes.
And your providers are your team, but you have to be engaged in your healthcare and sharing and talking and learning to speak that language so that you can get the help that you need.
It's so true. And I realize that your experience with chronic pain, your journey has been a long one. Mm-hmm. And we're 21 years in for you now. Yeah. What strategies have you pursued in managing your pain, and how has that changed over time? Because I know in 21 years, you've learned a lot along the way.
A lot.
So how, share a little bit, if you will, with our listeners, how you started and how those strategies kind of changed as time has gone on.
Sure. The first 3 years were the worst strategy. I would go into the provider's office crying and saying, help me, something's wrong, fix me. Where does it hurt? It hurts everywhere. It's getting worse, help me. And that was not the language that they spoke, and I didn't get the help I needed. When I finally got to the 42 doctors got it wrong. The 43rd doctor, he ordered my medical records from the other 42, and he went through those records before he even saw me. So he had an idea of who was walking through the door. And I came into the door, and he said, I think I know what's wrong. And I stood up for myself the first time and said, well, I am not going in for a medical procedure until I go home and study it. And I went home. He said, you have as much time as you want, but I feel like this can help you. And I went home and I studied it. And a week later, I went in and I got the testing, which was under anesthesia, and I was diagnosed. And that was the first time someone looked at the whole me, and the first time I advocated for myself and didn't just do what the person in front of me told me to do. I said, hey, wait a second. I want to go hear other people's opinions, read about this, study it, learn it, research it. I did that. And now with the internet, back then in 2002, the internet was not brand new, but it wasn't robust like it is today. And you'd have a lot easier time looking stuff up today. But learning that how do you talk? How do you communicate? When I changed from help me to I have burning fire pain 24 hours a day. I have sometimes electric pain that hits me like lightning out of the sky, and I never know where in my body it's going to hit. To I have spasms And finally, a doctor saw my face spasming and said, "Oh, that's what you mean by spasm," when it was like my face fluttering. All of these different adjectives result in different treatments and things that can help. But until I used those adjectives, they were just throwing things at me, trying to get it to stick to the wall, to the point of one medical provider told me, "You are going to die if we don't take your rib out." And I didn't listen. So it went, I listened to him. I thought I was going to die. I went in. I didn't listen to myself or even ask a question. I just didn't want to die. So I did what I was told. It was the wrong thing. Moving forward, I started asking questions. I started researching. I started learning their language and being able to share that and use that in my appointments. I learned that bringing somebody with me to my appointments was very important, because we go into this vortex in the doctor's office and you go in there and you're like, yeah, that makes sense. And you walk out and you're like, what medicine? What am I supposed to take when? Why did he say I needed this surgery? All those things that you were hearing sounded right in the moment, but you walk out and they go away. Having someone there that can listen, take notes, as well as ask questions and be there to be when you tell a doctor what you're going through, they think it's subjective, meaning there's no fact behind it necessarily. And having that other person in the room that knows you and has seen these things happen to you, they're now an objective finding. That, yes, Barbie passed out at this time. She was out for 2 minutes. Whatever it was, that's an objective view versus I felt like I passed out or everything went black. How long were you out? It felt like 30 seconds, but it was 2 minutes. That person's there, and it changes the dynamic of what the doctor believes in that situation, especially when it's a male companion. The doctors believe that a little bit more. But I learned that bringing my husband with me to my appointments, one, he understood why I needed to take these medicines on these days at this time, and it needs to be the same every day. He learned when Barbie's in a flare, these certain tools, we created an oasis. These things in my oasis are there, but I'm in so much pain I can't always remember to use them. He's there to say, oh yeah, this tool could work for this situation, and be that guiding voice to help me in the day-to-day in between appointments. I also created a one-pager. Every time I go to the doctor, I bring a one-pager that says, these are the medications I'm currently taking. These are the medications I've had trouble with. These are most recent issues. These are my long-term issues. And I update it, bring it with me. And I've actually had my primary care doctor call the hospital ahead of time and say, Barby Ingle is on her way into the hospital, and this is her most recent issues. Here's her medication. He doesn't have to dig through his own records and notes. He can call the hospital, and they're ready for me at the door. So that has been very helpful. And sharing my story and my journey, and the microbiome testing, getting to know me on a cellular genetic level has been very interesting and helped a lot in improving my care, especially since 2017.
This is such important information for our listeners, Barbie. And I tell you, the ace in the pocket is your husband, Ken.
Yes.
And I say that about my husband, Ben. There are care partners, right? There are partners in this. And whatever term we use for them, care partner, caregiver, it doesn't matter what phrase we use to describe them, there are partners in this, and they need to be engaged and involved. And when they are, it helps us 1,000%. It helps create that translation for the healthcare system, right? So I'm so glad you brought up the importance of care partners. We're going to be talking a lot more about that on future podcast episodes. What do you want our listeners to know about chronic pain that we may not have covered yet?
Well, I would say, especially if you're a new chronic pain patient, create your oasis. Find those tools that help you. For instance, I use a plastic cup and a straw. to drink so I don't have to tip my head back. I didn't learn that from a provider. I learned it because I tried it one day, and when I tipped my head back, it actually scientifically cuts off the fluid flow from your brain and spine, which can cause some issues, especially if you have chronic issues. Things like that. Learn about your things around you and make some changes to lighter plates. Like I use paper plates versus a hard plate. I dropped a lot of plates to learn to use paper plates and not break my dishes. Create that oasis, research and study, learn about your condition, and find out what's coming down the pipeline. And don't get stuck in the same treatment plan. If it was what you used 5 years ago and you're still using the exact same thing, there are constantly new things coming down the pipeline. Look and see if anything else could be better. It might not be, but at least look and see, what are my options, what are my choices. And then drinking enough water and eating the right foods. I know it sounds, change my diet. I'm not saying get skinny. I'm saying find the things that fuel your body the best, and it's going to be different for every single person. People would say, a salad is great. Eat those tomatoes. Well, for my body can't process tomatoes. It turns them into kidney stones. I'm not eating tomatoes. I know this is going to happen with my body, and I'm not going to do that. But another person, a tomato might be the best thing that they need. And so eat a tomato. Find out what is the right things for you to eat. You can do the elimination diet, or you can do the microbiome testing and biodome. I feel like I live in a biodome. But you find what is best for you individually and make that your world.
I love it. Now, I want before we wrap up today, I want you to tell us more about the International Pain Foundation. I know you got a conference coming up soon, right?
We do. The conference is in November. It's the International Pain Summit, and I actually was the president of International Pain Foundation for 10 years, and we have new board of directors, so they're doing things a little bit different, but they have added research into our projects. So we do awareness, education, social events, and now research, and like lab research, as well as some social research. And you can go to internationalpain.org and read all about the conditions that we work with. There's over 150 conditions, but pretty much everything is chronic pain related. And it could be muscle pain, skeletal pain, nerve pain, emotional and spiritual pain are areas that are being covered now. And it's a wide gamut. There's things there that are resources specific to conditions, and as well as chronic pain in general. There's resources, tips, tools, videos. We have past summits online as well, where you can go and see. We've had some amazing presenters over the years. We've been doing the summit since 2007. Was our first summit. So you can go back and look at a lot of great presenters, topics, and find things that help you, and also use those providers as resources if you have a specific condition. Remember, not every doctor is, just because they're a neurologist doesn't mean they treat all neurological conditions. They specialize in diseases. So if you see one doing a presentation, or a patient leader doing a presentation, go and find those people and research them and see what other information and things that they have to offer.
Oh, fantastic. So, Barbie, before we part ways today, I want us to leave something with our listeners. What can they do? What can they do to help move the needles on this issue? Do you have any advice for folks who maybe they're dealing with chronic pain, maybe they know someone who is? How can we move the needle on this issue?
When you find things that work for you, talk about it, share it. I've talked about it with the people doing my hair, or just randomly passing me by in the grocery store and with their cart, and be like, oh, hey, I noticed you got a brace on your arm. Let me tell you about chronic pain in my journey. And hopefully they can get treatment faster and quicker because you're sharing your story. As well as know that there's great reason for hope. All you have to do is reach out and seek it. When we reach out and say, hey, I need help in this area, that person might not necessarily be able to help you that you've gone to, but they might know somebody. And we can use that network and create that network to pull us all in to make a big picture and helping hand for all the people around us, whether we know them or not. Let's raise everybody up.
Let's do that, Barbie. I love that. I'll let that be the last word. Thank you so much for joining me today. And for my listeners, join us next time on Us versus Them, Patients and Caregivers Confront Healthcare.